Thank you very much, ladies and gentlemen. I'm going to be discussing something that to a lot of people seems like an insurmountable task. Everybody here wants health care. However, there's a percentage you can't afford it. In our modern day society, though, it's a service that everybody needs. It's not something you kind of need, you will need. Everybody's used the healthcare system. Now, there's two sides to this argument raging in Washington. There's the left side, which is called the Democrat side, to let the government provide a comprehensive plan. The right side, to let the insurance companies continue to run the system status quo. Which will work, in my opinion, my humble opinion, neither. None of these systems will work, and I'm going to explain why I think they will not. The left side, in my opinion, through taxation, which will happen if they go to the global healthcare system, will take away disposable income, therefore hindering the service sector from being profitable. Things like Starbucks, clothing stores, the movie industry. However, the right side will see no change at all, and therefore we will not be able to have any global healthcare system, a system that we know that everybody needs. Ladies and gentlemen, may I propose a new type of system that is more equitable, and I call it the healthcare banking system. Now, I know when you hear banks, you get very upset because there have been a lot of problems with our banks. But the reason, I'll explain later why I'm using the name bank. So I'm going to break this speech down into 5 topics or 5 subject matters. First of all, the healthcare system, I'm going to explain, it'll use available accounting practices and solutions to run the bank. There will be a network of banks across the country, and that means that healthcare will be affordable to everyone, and the banking systems will be networked as they are now in like the ATM system. There will be shareholder interest. Otherwise, the American public will have shareholder interest in every single bank. Not a corporate, it'll be shareholder interest. There'll be allocation of funds given for each shareholder when he needs health care. And the one caveat, there will not be the allocation of funds for the non-shareholders. This banking system, you must contribute to get out, to get the health care out of it. So let's revisit what the left and right want. The left, essentially, in my opinion, you get a stronger central government, which some people want. The right, they just all about profits. They're saying we need a more profitable system. That's what will make the system better. Well, the stronger central government to me, I'm not going to say this in terms of a derogatory sense. I'm saying this in terms of trying to build something more symbolic in the way a stronger central government would act. It would be more pushing towards socialism, communism. But I don't like those systems because I feel like there's a comedian said living in communism is like living in high school for the rest of your life. And the problem with that is that the government starts assuming too many responsibilities for the decision making you make with your money. However, the all-for-profits guys, it'll turn the system into the wild, wild west. It'll be basically a dog-eat-dog world where the system looks like the movie The Good, the Bad, and the Ugly. I don't know if you've ever seen that, but it's a really brutal movie about, kind of a weird way of looking at capitalism gone wrong. So we have to abandon our current system and go to some, if we want global health care. I believe it's non-commercial approach. It's an ownership system. It's a system run by local communities and a system accountable to local communities. And the accountability part is really fundamentally the most important part. Because right now we do not have an accountable system. So why did I say a bank? I said a bank because banks have fundamentals that I like that would represent what the services, would represent the services that the healthcare system needs. Excuse me. One is they make loans. The loan would represent when you needed healthcare, the loan would be made to you. And I'll explain, before we react to that, I'll explain what I mean by that later. The bank holds assets in a structured way. Already now, banks can hold assets, and they have an accounting system, they have the rules set up so that they handle assets in an orderly fashion. Banks can provide the framework to make payments, the loans, in an orderly fashion through sound banking practices, unlike what's been happening as you see on Wall Street. And all this structure can be used for an orderly and timely distribution of money for the healthcare services. So the big thing about a bank, it's an already known system. Plus, there's experts who can assist us in running the system, who can be hired. Instead of trying to come up with a whole new set of rules, it's more the banking system is already there with a couple tweaks to it. So, first of all, I said the accounting systems. Today, with the modern computing technology, accounting has become less than trivial, but it is very easy to build a really very integrated accounting system with security in it. Many of the tasks are automated now with the solutions available. So cost of ownership is low. Minimal staffing. Also, the information systems now, you can log onto your bank account and you can see daily accountability where the money's going. The system will provide high-level accountability. All transactions, and this is something a little bit different than is going on now, all transactions in the system will be publicly available. And there will be regular quarterly accounting done so that everybody will know exactly where the money is going at all times. And this can be achieved right now because we do it in every computer system that's out there. Take, for instance, UPS. When you do a package delivered, on an hourly, if not daily basis, you can see wherever that package is. So again, the system I have proposed here, the very fundamental system that will be the backbone, it'll be highly accountable. The network of banks, we have networks already available right now. They're called the ATM machines. You can go anywhere in America, and with a card, you can go to your ATM machine and withdraw cash. That would be the same way would happen in the healthcare in case, say, you're visiting someone in another banking area that the healthcare banking system would cover, and you would need emergency care. Simply, there would be transfer of funds between the bank that you have your account in to the bank that you were getting services from. And when you move to a new bank, a new area, all your credits would be transferred to that bank. Everything would be accountable. The only problem is, I know you're probably thinking about this, the cost of care between states would be something we'd have to work out, but there would be a prorating of that. Now, finally, the shareholder interest is the very fundamental to make the system work. Everybody must put equal amounts in. We take total cost and divide by shareholders, and everybody puts that money in there on a quarterly basis. When you go for health care, a loan will be made to you. The loan will go directly to the hospital. However, that money